We welcome everyone to this session of the webinar, HealthTech, NDPR and Patients Rights. A lot of persons have been asking, how do the three topics correlate? And we are going to see all that play out today. But before we begin, we have an introductory remarks from one of our own person, a partner and sector head at Jackson Eti and Edu, Mrs. Chinyere Okorocha. You have the floor, ma'am.
Thank you so much, Ifeanyi Okonkwo, one of our senior associates who will be moderating this first session today. Good morning, distinguished ladies and gentlemen, and thank you so much for joining us today for this webinar. My name, like Ifeanyi has said, is Chinyere Okorocha, and I'm one of the partners at Jackson Eti and Edu, the organization who put together this webinar today. The topic for discussion is Health Tech, NDPR, and Patients' Rights. And today I'm hopeful and very excited that we're going to be discussing or addressing the problems and opportunities, we say, that might come into play when you put these three interesting topics together. I also happen to be co-head of our health and pharmaceutical sector at Jackson Eti and Edu, and therefore it's within the purview of my duties to welcome you here today. I want to particularly thank all the panelists and the speakers who are captains of industry for taking time out of their busy schedules. I know that it is very difficult to even find a minute to do any extra in the performance of our duties as professionals, regulators, government officials. So we are very grateful to each and every one of you for being with us here today. We also want to thank all or welcome all the attendees to this webinar. I can see a lot of our clients are here. Thank you so much for your continuous support over the years. And I can see some new friends, names I don't recognize, who are here today also. You are all welcome. So like the topic suggests, today we're going to be looking at the Nigerian healthcare industry. And I mean, the statistics speak for themselves. Unfortunately, access to affordable healthcare continues to be a challenge in Nigeria. I mean, we're not going to delve too much into it, but I must mention, that the statistics are dismal. Our own doctor to patient ratio is like 1 to 6,000. I think the Minister of Health said the other day, who recommended is 1 to 600. Infrastructure, in the healthcare industry is a non-starter, to cater for the wide population that we have. We all know about brain drain, and our talent leaving ever so in throes. And of course, primary healthcare space also leaves much to be desired. So what can we do? What's the way forward for Nigeria? And so we want to look at, how technology has come to the rescue, should I say? Because what brought it out, so succinctly was the COVID-19 era, an era where we shut down businesses and we couldn't go anywhere for at least 12 calendar months. Everybody was in one place at the same time. And I think to a large extent, health tech, or let's say telemedicine, as we sometimes like to say, came to the rescue. The use of technology became so rampant during those years, and patients and doctors could actually come together, but in the virtual world. So consultations were going on, there was transfer of information between the patient and the doctor, but remotely. And whilst it's a great thing that you could consult, and we now do continue to consult virtually, it poses some problems too. So technology being passed through the internet, on platforms that might not be so secure. So it does raise the question about the data being transferred or being transported or being shared with your healthcare provider. How safe is it? As a patient, how can you be sure that your data doesn't end up in the wrong hands? That your medical information doesn't suddenly appear on the internet somewhere? So whilst we're using technology and it has disrupted the traditional means of providing healthcare services, there are some challenges to it, and we're going to look at that today. So the good part of it is that I looked up a definition of health tech provided by WHO, and I'm going to read it to us all so that we can get a sense of exactly what we're talking about today. So it says, and this is the WHO definition, that it's the application of organized knowledge and skills in the form of devices, medicines, vaccines, procedures to solve health problems and improve the quality of life of people in general. So it's not just about the consultations that have become virtual. It's about the medical devices that technology is helping to provide healthcare services. There's robotics, involved. There's AI sometimes involved. There's the collation and storage of our data in terms of our medical data being used by technological advancement tools. And I think that the thing is that it did exist before COVID-19. So there were all the telemedicine and telehealth health tech companies in existence before COVID-19. But what COVID-19 did is it made it, I think, more acceptable as clients, let's say clients, because I'm a lawyer, but patients were a little bit skeptical or more skeptical than they are today. And COVID-19 kind of accelerated the use of technology in the provision of healthcare services. But then, yes, in providing the services and using technology, is the standard of care diminished in terms of the healthcare provider? And we're here to tell you today that no, you even have a stronger burden of care placed on you as a healthcare provider when you have to use technology in any form or manner in the provision of your healthcare services. And data, the issue of data comes up. And so two regulatory bodies that we're going to be looking at today, kind of to tie it all together. What does the law say? As a medical legal practitioner, I'm interested in what are the provisions of the law, what regulations are in place to ensure that we get the best possible care as a patient, but that the medical practitioners are also protected. So we have two agencies, the National Information Technological Development Agency, popularly known as NIDDA, which came up with the NDPR, which is the National Data Protection Regulations that we're going to look at today, as well as the FCCPC, you all know them, the Federal Competition Consumer Protection Commission, which also released regulations in terms of the patient's Bill of Rights. What rights do I have as a patient? What can I demand of my medical practitioner when they provide services to me? How is my data protected? And why must I, as a medical practitioner, comply with the provisions of the NDPR and the Patient's Bill of Rights? And indeed, if you're saying I must comply, what are the penalties, if any, if I don't comply? These are some of the issues we're going to be looking at today, because the NDPR has classified health data as sensitive data under Regulation 1.3. And once it's sensitive data, the standard of care becomes even more difficult, or let's say more onerous, because not only are you responsible for keeping that data carefully, you're going to be held accountable. You have to provide how you store it, and you also have to say how you have put security measures in place. All these are going to be discussed by the experts today. And also a bundle of rights that we have as patients, the right to be told, the services an establishment has, in their bouquet of services, the right to say whether or not your data should be stored, the right to say you want your medical file, or there are a bundle of rights all here. The experts are here. They're going to tell us all about it. So we thought, Jackson Etianedu, that we needed to tie all these rights together. The fact that your data is being stored by your medical practitioner, and there are laws as to how it can be stored, how it can be used, and what security measures are in place, as well as the fact that as a patient, there's certain rights that you do have, are they being adhered to? And then as a medical practitioner, are you protected in terms of the provision of these rights, this duty of care that you owe your patient? To what extent may you be held liable if something were to go wrong? Does that sound like it's going to be interesting, ladies and gentlemen? I think it is. I really do think it is. So who are we, Jackson Etianedu, and why do we think we should bring this webinar to you all today? And I dare say we're a law firm, but a law firm with a sector focus, and a sector focus that we're being in the forefront today is our health and pharmaceutical sector. I guess the screen shows that we do provide the full ambit of legal services in terms of 9 practice areas. And then we have 6 sectors of focus on the right hand of your screen. But today it's the health and pharmaceutical sector that is bringing this webinar to you. We realize that clients not only want you to know the law, but they want you to be conversant with the industries where they operate. And therefore, if we can marry our knowledge of the law and regulatory framework with the industry knowledge, we have become trusted advisors to our clients, such that when we're giving them advice, legal advice, it is actually based on industry standards. And our clients here on the webinar will attest to the fact that we're good at what we do. And hopefully after today, a lot of you will become our clients or come to us, just for complimentary advice if you want. So once again, I want to welcome everybody. 26 years old, that's what JE today. We have 10 partners, support staff of over 100, and paid legal practitioners, we're about 70 strong. So we are a large firm, and we're very happy of the heritage that we've had. And we're very grateful to all our clients who are on the call today for staying with us and being part of our journey. So as I round up, I once again want to say thank you, everybody, for coming, for being here today. Please use the question and answer box to put in any questions you might have today. It's very important that we try and capture and answer as many questions as we can during the course of the event, so that it is useful for you. It's always our aim to make sure that there are key takeaways from every webinar that we have. And at the end of the day, we are going to bring out a communique which gives a recount of the event and next steps for every medical practitioner or service provider, stakeholder that might be on the call today. So at this point, I think my job is done. I'm going to hand you back to the Ifeanyi, who is going to be our compare today, or our moderator. He's a senior associate in our firm. Very intelligent young man, and his CV is up there, or a brief profile for you to read the amazing things he's up to. And Ifeanyi, back to you.
Thank you very much, Chinyere, for that wonderful introductory remarks. And without wasting much time, we'll begin quickly. So this is how the program would run. We would have a brief, we'll introduce our panelists, and immediately we'll delve into the issues. I will be starting with the introduction of our panelists. We have Dr. Vincent and Olatunji. And yes, Dr. Vincent Olatunji is a certified public-private partnership specialist, and of course, a PCB certified data protection officer. He has worked in the public sector for almost 30 years, thereby acquiring practical proficiency and a thorough understanding of government operations in Nigeria and other countries. He brings on board significant experience in team building, research activities, and whatnot. He has represented NIDA and Nigeria at several levels, and he was listed among the 100 level leading telecom and ICT personalities in Nigeria. Recently, he was appointed by the president to be the National Commissioner, NDPB, that's the Nigeria Data Protection Bureau. And also here with us is Florence Abebe. Florence Abebe is she's representing Babatunde Rukera, the Executive Vice Chairman of FCCPC. So Florence Abebe is the Chief Legal Officer with the with the FCCPC. She's currently deployed in the Office of the Executive Vice Chairman as his technical and resource personnel. Florence is a lead competition analyst with the Commission. She undertakes several statutory investigations, mergers, and acquisition analysis, and is involved in drafting several regulations and guidelines. As part of the office functions, Florence represents the Commission as a focal person in several departmental committees within and outside the Commission. She's a focal person for various development partners with respect to competition and protection, consumers protection, the World Bank, Federal Trade Commission, and the rest of that. So currently, she was elected as the alternate chairman, Competition Consultative Committee of the ECOWAS Regional Competition Authority, in recognition of her outstanding capacity as a budding competition expert and dynamic regulatory skills. We also have in the house Dr. Ferdinand. Dr. Ferdinand is the medical director of SEDACRES, representing Dr. Felix Ogedebe in this webinar. Dr. Ferdinand's interest is in reproductive endocrinology and infertility. Of course, he aims to help reduce the burden of infertility and assist couples who are desirous of conception. He's also interested in the furtherance of research in obstetrics and gynecology, with an emphasis on reproductive endocrinology and infertility, and also maternal fetal medicine. He's currently the medical director of SEDACRES Hospital, Abuja. We also have with us Ifeoluwa Olokode. She is the head of the Public Health and Data Partnership at Helium Health. Of course, she's a biology nerd that has turned to a technology enthusiast, and she's doing very well now with a lot of startups both at New York, London, and Lagos. With her attitude for uncovering areas of synergy across departments and companies, she has also helped in the launching and implementation of partnerships with entities like MIT Soft, Johnson & Johnson, Merck, KG&A, Airbus, BizLab, just name it. Ifeoluwa continues to make her interest in using technology to solve entrenched problems and her passion for improving healthcare access at Helium Health, which has led, Helium Health to the place they had now. Of course, she holds a bachelor's degree in biological science from Mount Holyoke College, Massachusetts. And then we also have Victor Benjamin. Victor Benjamin is a co-founder at Remedial Health. Helium Health and Remedial Health will recall, for those of us in the health space, they are health tech companies that are making the waves in Nigeria. Victor is the co-founder and chief operating officer for Remedial Health. At Remedial Health, Victor and his team leverage on technology to improve affordability and accessibility to authentic medicines for healthcare service providers across Africa. Of course, Victor is also a salesman by passion with over 10 years experience in pharma and medical sales. An MBA holder from HealthTech, he also owns a chain of retail pharmacy outlets in Lagos and in Ogun State. And then we move immediately to the session where we'll be unpacking the issues around HealthTech. But yes, apologies. Also with us is one of our partners and head of the Data Protection Compliance Organization Unit at Jackson and Edu. Her name is Ngozi Aderibigbe. She's a partner at JAE where she oversees the data protection practice. She's also the sector head of technology, media, and entertainment. She's also the chairperson of the NBSBL Intellectual Property Committee. Of course, our experience with data protection includes contributing through interfacing with NIDA in framing the outlook for the data protection landscape in Nigeria. Ngozi is particularly skillful in investigating and analyzing data collection processes, identifying data protection lapses in data protection procedures and documentations, talk about business and technology designs, talk about drafting watertight data protection remediation documents, ranging from data privacy policies to data transfer agreements, data sharing agreements, data policy, and all that. She's just an expert in the field. She's also known, of course, our expertise in this field is not perfect because she did some, she had some stints with some UK firm. And so she has a good knowledge of also not only the NDPR, but also the GDPR. And she has written in some technology and law reputable platforms like Thomas Reuters, Law Business Research UK, and International Comparative Legal Guides UK. She has conducted over 30 compliance data audits for companies, over 30. And so you can begin to think between 2019 till now, and that's how far she has done. So we'll delve into the issues for the day. Without much ado, let's begin with question 1, and I think I'll begin with Dr. Ferdinand. Yes, so Dr. Ferdinand, we know that, of course, before the introduction of PBOL, that's the Patients' Bill of Rights, which we hear so much about today, and before the introduction of the NDPR, the Nigerian Data Protection Regulation, we know that the healthcare space is not akin or alien to patients' rights. And so I want to ask you, how important are patients' rights in the delivery of healthcare services before and after the Patients' Bill of Rights? What has been your experience regarding this as a medical practitioner? I think we have a glitch there with Dr. Ferdinand. Perhaps we can move immediately to ask the same question to Florence. Let's have Florence. I know one of the giant strides achieved by FCCPC is the launching of the Patients' Bill of Rights. So can you throw light on the background behind the need for that bill, and probably a summary of the Patients' Bill of Rights, so that our audience can understand what these rights are?
Thank you very much, Ifeanyi. Good morning, everyone. It's a real pleasure to be part of this discourse. And the panelists, the earlier moderator was right when she said that the Nigerian consumers are key stakeholders when we talk about our health sector. And so what the Patient Bill of Rights was, to address some of the concerns in the sector. And by way of institutional history, let me just say that the PBR was developed in 2018. It was launched then. And at the time, what you now know as the FCCPC was the CPC, the Consumer Protection Council. And so at the time, we had a single mandate for just protecting consumers. And so with the coming into force in 2019 of the FCCPA, we now have a dual mandate of not just protecting consumers, but also competition. And so in 2018, when we were just the CPC, what we sought to do was to understand the health sector. We looked at several studies that had been conducted and just to understand what consumer perception was and the mortality rate. And a large percentage of Nigerians associated public health in Nigeria with low quality. And so what we did was we considered the roles of all the sector players, whether private, public. We got commitments from the private sector through their association, the Nigerian Medical Association. And we collaborated with critical stakeholders like the Ministry of Health, the civil society, and a lot and other stakeholders, including chief executives in the medical sector, to develop what you now know as the Patients' Bill of Rights as a standard setting tool for consumers and healthcare practitioners alike. And so the objective of the PBOR was to ensure that consumers are more assertive, they know their rights, and to improve
I think we lost Florence there. But on the slide, we would see on our screen, we'll see the summary of the Patients' Bill of Rights, what they have, and for easy identification of these rights. We hope to get back Florence there in the Nigerian network situation. Okay. Can we move to the next question? I would like to ask Dr. Olatunji. Yes, Dr. Olatunji is here and she is ably represented by Babatunde Bamiboye. So since 2019, starting with NIDA and now the NDPB, the championing of data privacy rights has been on the rise. Yet it would appear industry players and Nigerians are oblivious of the provisions of the NDPR. So can you throw light in summary on the various rights of the data subjects in relation to the healthcare space?
Good morning, good morning, everyone. We are excited to be here. I bring you warm greetings from the National Commissioner, Dr. Vincent Olatunji of the Nigeria Data Protection Bureau. Now, a very quick one. I'd like to correct Chinyere, who said we are coming from NIDA. This is Nigeria Data Protection Bureau. She mentioned earlier that we have NIDA and FCCPC on board. So having said that, thank you very much for inviting us. Dr. Olatunji will have been here, to give the speech, but for some other pressing engagements, prior engagements. Now back to the question. Yes, of course, the NDPR itself, as you rightly said, was introduced in 2019, and as a whole, you could refer to it as a framework of rights although under Part 3 we have specific rights, but generally they are rights, beginning with the principles of data protection itself, which which tells data controllers what to do in terms of lawful processing of rights. Generally, the patient going to the hospital expects that if data should be processed, it should be done legitimately. It should be done, there must be lawful basis. Of course, there must also be consent. Also, accuracy is important. These are rights that the patient ordinarily should be interested in. And also, I think Chinyere White speaking mentioned the issue of duty of care. This is more or less a novel provision that we have under the NDPR. I really, the GDPR is not, of course, everything is about duty of care anyway, but of course, specifically, this is mentioned under the NDPR, that everyone must, exercise the duty of care when you are processing the data or you are in custody of the data of any data subject. Now, specifically, you can go to the rights of data subjects, generally under the Part 3 of the NDPR itself. Under Part 3, you have that you must provide your privacy policy, and of course, any measure that you will be using in relation to processing of data, you must provide that information relating to that in a concise, transparent, intelligible, and easily accessible form to the patient. So this is also akin to what you have under the Bill of Rights. It talks about to give information. But one particular thing I think we should find quite interesting is the angle of informed consent. It's not just to be informed and to give informed consent. Is the consent really informed? What does it mean that the consent is informed? It means under the NDPR, the General National NDPR, that the patient is fully aware of all the pros, let's use it that way, all the pros and the cons of a particular way by which you want to carry out this method of processing this data. And therefore, if you don't provide this data, if you don't provide this information, and then you are asking that you should subscribe to give consent to data processing in that regard, it wouldn't meet a standard of informed consent, even if consent is given. Then again, we also have confidentiality. This is also in the Patient's Bill of Rights, as well as under the principles of the NDPR, the data processing. So this also is important. How long does these things, or the medical records, the way you keep them, who has access to them, the safety of the record, the security, and all that. These are things that we have under the NDPR, and also even prior to the NDPR, the patient is entitled to. If you remember, there is a case of Kukunko versus Medical and Dental Practitioners Council. It's a case that we refer to as a locus classicus in the area of privacy. At that time, it was based on the 1979 Constitution, the provision that we have relating to the 1979 Constitution is our own Section 37 under the 1999 Constitution. This case is about the privacy of the patients. and the measures that a medical practitioner should take in, getting the consent of the patient to go into, to carry out a medical, a medical intervention, as the case may be. So also the NDPR is founded on section 37, the same section 37, which was the cross of the case here. So basically, there is a relationship between the NDPR as well as the rights of patients in practice.
Thank you very much.
Thank you.
Babatunde, thank you for that wonderful elucidation. Of course, the rights of the data subject is right there before us on the screen, as well as the patient's Bill of Rights. We lost Florence for a moment when she was explaining to us the patient's Bill of Rights. Florence, can we come back to you now and have you quickly summarize the other part of what you were going to say?
Yeah, I'm so sorry about the network glitch. So yes, I was just trying to say that the PBR is really an aggregation of patients' rights that already existed in either the Constitution, as the earlier speaker had mentioned, or Child Rights Act. And so these are codes that already existed. And so what we just tried to do was, to get a consensus that the PBR was vital to rebuilding and promoting this consumer confidence in the sector. And you've spoken very well about the key rights covered by the PBR, whether it's your right to information and appropriate disclosures, confidentiality, emergency care, dignity, etc. The PBR is the initial step in this journey to a clean bill of health, which is aimed at ensuring, full and adequate protection for our patients, as well as ensuring that, we improve our national health status and promote public confidence. Thank you.
Thank you very much, Florence. Let me come to Victor. Victor, so we know that Remedial Health is one of the health tech companies that has disrupted the traditional healthcare process, and also has assisted in providing support for Nigerians. But have you been able to measure the level of impact health tech has achieved in providing support to the healthcare industry? Is there any correlation?
Thank you so much, Ifeanyi. I bring you greetings from the Remedial Health team. Yes, we've been able to measure the impact of health tech in the healthcare industry, and I'll tell you, it's a great one. Health tech has actually improved the quality of healthcare delivery in Nigeria. So, looking at operational efficiency, it's something that is worrisome. Health tech has come to play and greatly increased and improved the level of operational efficiency in the healthcare sector. So, and I would like to say that the goal of all players in the healthcare sector is one, is towards the well-being of the patients. And this is what we are driving through the use of tech. So permit me to narrow the impacts to our own remedial health solutions, and I'll list most of the impacts that remedial health solutions have been able to provide in the healthcare sector. Firstly, health tech has increased and greatly combated the fight against counterfeit drugs, counterfeit and substandard medicines. As you know, the influx of counterfeit medicines into the pharmaceutical space is something that Even the regulatory bodies, they've done a good job, but still not enough. Today, HealthTech has gone a step ahead of these criminals and creates easy access to verification of authentic medicines to healthcare to the patients in question. So through MES mobile authentication services, patients can confirm the authenticity of the medications that they take today. Through USSD, barcode, SMX testings, all of this has been improved. Through telemedicine, you agree with me, a lot of lives have been saved today in remote areas and in cases of emergencies where a healthcare practitioner is not within reach. Now, at Remedial Health Solutions, we say we are digitizing pharmaceutical procurement, and we are leveraging on tech to action this, to make all of this happen. And one of the impacts is, I would say we are a B2B business. And one mutual conviction that myself and the co-founder share so strongly is that we believe none should be denied access to good and quality healthcare services.
Thank you very much, Victor. Thank you very much. You spoke. I'm really interested in the measures technology has played in combating a lot of counterfeits in the healthcare space, and I suppose that would require a lot of data and intelligence to be able to do that. So let me ask this question. Let me put this question to Ife Oluwa. Ife Oluwa, Helio Health is one of the leading health tech companies in Nigeria. Of course, in your experience, would you say that health tech companies have enough patients' data at their disposal to better serve the healthcare or better serve the health industry?
Thank you for having me. So I will start out by saying that health tech is still in its infancy in Nigeria, especially when you compare it to fintech, right? I like to use the comparison because fintech is decades ahead of health tech. And with the fintech innovations that you've seen, the core infrastructure, which is NIBS, right? The interbanking infrastructure that enabled us to easily do bank transfers. That interoperable layer is the thing that really shut off fintech in this country and enabled kind of all these exciting startups like Paystar, PiggyVest, all of that. So comparing that to health tech, I'll say health tech is still in its very, very early days. We don't even have that kind of central interoperable platform that's allowing easy exchange of data now. So I would say, early days still. And really, when the founders of this company got together, the original idea that they had was to make healthcare data available. So they kind of wanted to do the NIBS of healthcare, right? But they soon realized that the healthcare data was trapped in paper, right? And they will now have to do the work of digitizing healthcare at the source, at health facilities. And that's how Helio Health came to be and has evolved thus far. So in terms when we're talking about, do we have enough patient data at our disposal? It depends, right? It does depend on the problem you're trying to solve. So if you are a healthcare facility that is digitized and you have an EMR, something has digitized your operations and you're trying to kind of plan your budget or something, yes, that's healthcare, that healthcare technology that you're using will have the data you need to kind of see diagnosis at a glance, see kind of where your resources are going to, etc. But if we're talking about kind of data, health tech companies having data to solve kind of broader problems in terms of on a statewide scale, on a national scale, I think we're still in the early days. There are a lot of things that need to be in place for that to be possible, right? So we're still in early days. We're building companies like Helium Health and Remedial Health are doing the work of making sure all of that digital infrastructure is available to make all of the exciting future things possible. But yeah, I guess the short answer is depends on the problem you're trying to solve. and the stakeholder you are.
Wonderfully answered, Ifeoluwa. Thank you very much for that insight. So I suppose there are still a lot of opportunities and a long way for the health tech providers to go. Let me come back to Florence. Florence, when you were mentioning the PIBO rights, you did mention right to access information, and I'm really interested in that particular right of the patients. So we know that in Nigeria, I mean, we've seen instances where patients would request for their file and the nurses would refuse. And in some cases, if at all they are shown the file, what you would see is some sort of encrypted handwriting by doctors that the patient cannot even make a sense of. And so you see the patients relying totally on the healthcare experts for their rights and all that. So would you say most healthcare providers are not aware of these rights of the patients? And what has the FCCPC done so far in enlightening the healthcare providers about this?
Thank you very much, Ifeanyi. Let me start by saying there is a direct connection between improved quality standards and the sophistication of consumers. And it's that sophistication that propels the demand for a certain level of service quality. And that's what the PBOR intends to do by codifying the rights to consumers and their right to access this information. Now, with respect to this right, a consumer has the right to have, to understand the treatment that is planned, the prognosis, and the scope of the service that's offered by these practitioners. And access to information becomes very key. It must be in a clear and understandable language. And the practitioners must also understand their responsibility. They must facilitate that understanding. And it's not just by answering questions. It's by making the appropriate documentation of the prognosis, the line of treatment, and why, and ensuring that those records are appropriately kept. Now, just as has been said in the course of conversation, the NDPR which came in a year after the PBOR, in essence, strengthens the rights as codified by the PBOR and says that a person has access to their data. They own the data. They are the data subjects, but the hospitals or the health facilities are the ones responsible for controlling that data. They're the data controllers. And so with respect to how the medical reports are encrypted, I can't really speak to that, but I can only tell you that it would be a shock for medical practitioners to say that they don't know that they should effectively ensure that their patients are properly educated about their rights to this information. As to what the FCCPC has been doing, we have hosted several engagements with chief medical directors and chief executives of several hospitals. You will know, because it's been in the news and most of our hearings are public, we've taken out several legal activities. For example, the very famous ones on botched surgeries, for example, and we are currently in court on several criminal trials on that. We are currently in the coroner's courts for people who allegations of negligence have come up, and we're participating in those investigative hearings. So more than ever before, we're seeing more complaints coming about the sectors, and we're engaging more with operators and sector regulators. You will agree that we have seen several doctors' licenses being withdrawn temporarily, if at all, in some circumstances, For example, the famous Dr. Anu, her license has been withdrawn as a result of the intervention from the commission. Also, we are hearing more or seeing more investigative public hearings in the medical sector. And so if you ask me, have we achieved what we intended? My question would be yes, to a reasonable extent. Do we need to do more? Yes, we need to do more. We still have a way to go.
Thank you very much, Florence. Thank you very, very much. It's really interesting to see what the FCCPC has been doing so far. I'm going to come back to you because I know a lot of our audience would love to know what practical step they can take to report some of these anomalies to the FCCPC. And before that, let me come to Victor. When Ifeoluwa was speaking, she did mention that gap between the kind of data we need and then the what the health tech providers would need to cover. So Victor, let me ask, how real or deep is the collaboration between the health tech players and the health care providers, especially in sharing of data? How real is that collaboration? Would you say there has been any collaboration at all? Or would you say that there are challenges faced by health tech providers and the health care providers?
Okay, thank you, Ifeanyi, for that question. So I would say the collaboration is great from the hospital end and from the pharmacy end. The collaboration is great. There's been good responses. So the feedback I get from most of our agents on feed has been pharmacists, hospital technicians, and frontline healthcare providers have been very, very supportive in collaborating in the release of data for our operations. All of that has been good. Where there is a challenge, basically, is with the PPMVs, that's the patent and proprietary medicine vendors. And the reason is very, very clear. Obviously, most of the PPMVs or the owners or the participants in the PPMVs are not so enlightened. But from the pharmacy end, from the hospital ends, the advantage, the leverage we have is, yes, we are dealing with a lot of bright minds, people that are enlightened, and so they understand the value contributions that we are proposing to them. But from the PPMVs, there's a challenge there. But from our own end, we have also worked in-house. We have trained our field staffs on how to proceed with all of these and handle all of these issues when they come up, and then still get to sign up these PPMVs on board, and then we can step up business. But so far, the collaboration from the healthcare sector, I would say it has been great from the hospital end, it has been great from the pharmacy ends. Where there's a challenge is with the PPMVs, and that is not far-fetched because of the level of enlightenment from that end.
Interesting. I would really wonder how that challenge can be overcome. But before we go into details on that, let me ask Ngozi, seeing how important health tech is to the healthcare space, certain issues around the data protection or privacy rights would definitely come up. And I would love to ask you, as an expert IP technology and data privacy lawyer, can you enlighten us on the meaning and importance of data privacy by design as it relates to healthcare providers and health tech?
Thank you very much, Ifeanyi, and good morning once again. Actually, it's 12 o'clock now, so I should say good afternoon. Okay, so we have basically been talking about privacy in the context of healthcare service delivery. And I think Dr. Olatunji gave a very beautiful background as to why this is important and how it interrelates very closely with the healthcare service sector. In terms of privacy by design, I would say it's just simply thinking of privacy as a preventive measure. So every healthcare provider is expected to comply with the Nigerian Data Protection Regulation, and of course the Patients Bill of Rights, as has been discussed. And at the heart of the Data Protection Regulation and the Patients Bill of Rights is privacy, right? The need to ensure that patients not only have information that pertains to their health, but also that that information is classified and it's not shared in a way that is inconsistent with the patient's wish and desire. Now, that's the whole essence of the privacy philosophy. Now, privacy by design means that when you set up your practice as a healthcare practitioner, you think about privacy, you think about ways of preventing privacy breaches. So basically, it's really like we say in medicine, prevention is better than cure. It's a way of ensuring that you have the architecture in place to ensure that by default, there is a privacy setup you have, whether we're talking about offline setup, your processes, the way patients' data is collected and how it is stored. You have an architecture that ensures that the privacy of that information is maintained. Now, on the e-health, coming to e-health, electronic health, there is a lot that can be said around privacy by design, because in this case, we're talking about a software that will be used to collect personal data, will be used to process personal data, and in many cases would also be used to share personal data. Now, the principles of privacy, some of which Dr. Olatunji touched on, need to be embedded or considered in developing that software. So for example, we know that consent is an important factor. It's not the only way to get to receive data lawfully or to process data lawfully. However, particularly in the context of healthcare delivery, consent is key, and whenever consent can be obtained, it should be obtained. Now, when you develop an app, what are the measures you put in place? How do you design the app to ensure that no one can go one step into the app without giving consent in all the ways that consent will be required, or consent to all the ways that that data will be processed? What I mean is this: you are using the app. Patients will be providing their information on the app, and perhaps you'll be providing that information to consultants at the back end or sharing that information with any other third party. How transparent is that information? How open is it to the user from the get-go? At the point where they are subscribing, or where they are getting on board, they should have that information accessible to them, and they should be able to give consent in a way that is unequivocal. If the design doesn't allow for that, then there's a problem, and that defeats the essence of privacy by design. So basically, privacy by design is geared towards preempting what the privacy challenges might be and working a solution even before the problem comes up, so that by default the application is complying with the data protection regulation. Now let me speak a bit about some of the key things that need to be considered when building whether it's a software or whether it's an offline practice that needs to collect personal data. First of all, like I said, it has to be considered proactively. So you need to think ahead and think about the possible issues. For instance, where children come to the hospital, you need to collect personal data about the children from their parents. How do you ensure that you're getting the personal data from the parent? What if it's not the parent that has brought the child? How do you get consent? These are things that should be thought of upfront, because if it's not the parent that is providing the information, what framework do you have to ensure that you can get the appropriate person to confirm that it's okay to release that information? You should also talk about the fact that it has to be a default setting within the organization. This also brings to fore the need for continuous education within your team. So everybody within the team needs to understand the role they play in the privacy value chain and how important it is for them to check that within their own work setup, privacy is also enforced, and compliance is part of what they do. So you don't want to be reactionary. You want to be proactive in how you lay out your privacy settings within your system.
Thank you very much, Ngozi. Thank you very, very much for that. That's a lot of information out there. So there was a case of Idowu Emmanuel, I think. What happened in that case was she had earlier requested for a case file, that she needs them, and I think she was refused. And then later on, something happened in the surgery, during the surgery. There was a problem that they couldn't attend to her for surgery because they couldn't find her case file. And that was the problem. Later on, complications ensued, but that's a story for another day. So what would you say are the common mistakes? And this question is still to you, it's still for you to answer. What would you say are the common mistakes or oversights made by not just healthcare providers now, but also possible common mistakes or oversights health tech providers may make or are making in relation to the NDPR?
Thank you, Faye. I think the number one mistake I would identify would be to believe that by complying with the codes of medical ethics, especially and the patient's bill of rights, especially in relation to the obligation around confidentiality, that they are home and dry as far as data privacy is concerned. I think what needs to be stated very clearly is the Nigerian Data Protection Regulation is another regulation that complements the patient's bill of rights, but also puts forward other prescriptions that are outside the scope of the Code of Medical Ethics and the patient's bill of rights. And it's important that medical practitioners and healthcare practitioners generally have that outlook, to privacy. So beyond what the Code of Medical Ethics and Patient's Bill of Rights recognizes as confidentiality, you have other obligations, and I'm just going to talk a bit about it. First of all, generally, the Code of Medical Ethics and the Patient's Bill of Rights are focused on patients as the subject of data protection or privacy. However, the Nigerian Data Protection Regulation goes beyond that. So it would include any personal data, whether the person is a patient or not. So if someone walks into your facility and doesn't end up becoming your patient because they didn't agree to your terms, but you collect their personal data, you are still bound by the rules as long as that individual is identifiable and they have provided that information to you. May I say also that it extends to employees. It extends to next of kin. These are information that generally you would get during engagement with a patient. A patient, in the course of giving you his or her history, might tell you, give you information that is about his family, things that are not necessarily directly connected to the patient's identity. You need to have a framework that covers the scope of all the personal data you have and ensures that the same level of protection is accorded across board. So that's number one. Another one that I'd like to point out is the thinking that you're not responsible for what happens to personal data when it is somebody else who has acted or taken who has access to that data. So let me give an example. If you think about EMR, medical records providers, the records are provided by the hospital. The hospital is the data controller. The hospital is the face that the patient or whoever is providing information sees and is saying, oh, you want this information, I'll give it to you. Now, the hospital as a data controller remains responsible for whatever happens to that data. So if at the back end, they pass up that data to a partner for, say, lab consultancy or any other reason, the hospital remains responsible for what the lab or the other partner does with that data. The only time where the hospital might be exempted is if the patient has elected to say, could you please pass up my information to this particular entity? But if it's a back end, arrangement that medical practitioners or hospitals have, then the hospital that collected that information continues to be accountable for that, for whatever happens, which is why the Nigerian Data Protection Regulation clearly requires that before you share personal data with any third party at all, you must do two things. Number one, satisfy yourself that the recipient has sufficient structure in place to comply with the Nigerian Data Protection Regulation, and that they indeed comply and they don't have a history of privacy breaches. Because the liability, you could be exposed to liability from the action. That's number one. Number two is to ensure that you have a data protection agreement between your entity and that entity. And even in drafting that data protection agreement, I'll tell you, I have seen quite a number of such scenarios where the company just signs because a data protection agreement is put in front of them. You need to study that agreement and get legal experts to look at that agreement to ensure that it protects you and ensures that your liability is contractually limited. And that's the whole essence of the data protection agreement. Because if you sign an agreement that exposes you, your situation is not any better. And these are some of the things I can highlight, for want of time. Unless Ifeanyi gives me the go-ahead to say more.
Thank you very much, Ngozi. Thank you very much. So two things really, and I'll come back to you on them. I think that will form the last part of the questioning. You've raised two issues really. The fact that the NDPR goes beyond the Patient's Bill of Rights, and and then the second issue would be, okay, there is a PBO, Patient Bill of Rights, to worry about, and then there's also the data privacy rights to worry about. I don't know how all that would go well for healthcare providers, but I'll come back to that. Ifeoluwa, let me come to you. So there is currently a mass exodus of Nigerian healthcare providers. Although not so long ago, we had the Minister of Labor who said that there are more than enough doctors and nurses in Nigeria. However, that position is. So, but what is your take on this, on the fact that there are enough hands on ground? And do you think health tech and telemedicine can fill in the gap caused by this death of medical experts?
I'm not sure where the Minister of Labor was getting his data, but I feel like we can all agree, it is common knowledge that we are a ways away from the WHO standards of kind of like, one doctor. I believe the standard is one doctor to 100 patients or something like that. Right now, I think we have one doctor like to 2,000. So like it's a ridiculous, right, gap. There is a significant gap. Then in terms of, so I disagree respectfully with the assertion that we have enough health workers. And I think that health tech can fill the gap, right? In terms of, we can extend the reach of doctors and other health workers with healthcare technology like telemedicine, right? For example, now, the case might be that people may not want to physically move to remote areas because they don't think their job prospects are so encouraging in remote areas, but people in remote areas also need healthcare. So how do we create a model of care that ensures that people, irrespective of where they live, have access to the care that they need? And that's where technology comes in and kind of rethinking the structure of task distribution and task shifting, right? So where you combine kind of like a community health worker, a nurse, plus telemedicine to easily reach a doctor, an easy referral system. So I think health tech and telemedicine can fill the gaps. But beyond the technology, we also have to be open to reimagining what healthcare access can look like and putting those structures in place. So technology alone cannot solve, technology is a tool. Of course, it will improve things when used properly, but we also have to kind of combine that with policy and kind of rethinking, and also educating and getting more health workers into the pipeline.
Words on marble. Thank you very much, Ifeoluwa. I suppose in filling that gap, or at least for those health tech providers we have, we've heard a lot about the data privacy rights and how it's come into that space. But I'd like to hear from the regulator. Baba, today, can you throw more light on how do healthcare providers and health tech companies fall within the radar of the NDPR, the Nigerian Data Protection Regulation?
Yeah, thank you once again, Chinyere, and I also want to thank all my co-panelists. We have actually been enjoying the discussion so far. So indeed, from all that even everybody we have been saying, the healthcare providers or health tech companies, they are data controllers to all purposes and intents. So to that extent, they fall within the scope of the NDPR. Well, of course, it's not just falling within the scope of the NDPR, it's also about the accountability in that regard. And we are putting measures in place to ensure that they are also accountable. And this is more so because without really recognizing the fact that they fall within the scope, and also without the measures that brings them within the accountability framework, Nigeria will not be able to meet what we refer to as the adequacy level under the global framework for data protection brought about by the EU GDPR. There is a level that you are required to be, and for that to happen, that means all data controllers, at least the major ones, virtually everybody anyway, respects the privacy of others. But I think there is a need for us also to shed light on what I think it was Ngozi that attempted to answer a question in respect of whether medical practitioners, she was just trying to explain why medical practitioners shouldn't just limit themselves to the Bill of Rights issued by FCCPC and their code of ethics. You know, the reason is this: the Nigeria Data Protection Regulation, and generally all of that regulations in this line provides a very extensive framework to protect privacy, and it is a fundamental right, and that is actually the idea. Other legislations, other instruments provide, for instance, the Bill of Rights is a shared responsibility. You do this, you do that, not limited to privacy per se, and that is quite excellent. Just about what you should do, this is what you are entitled to. But now coming with a standard that is in line with the fundamental rights. And the courts today, they interpret the NDPR as a corollary of the fundamental right that you are entitled to. So no medical practitioner or a health tech person can say, oh, because I have code of ethics, I don't think I fall within this. We'll be making a very big mistake in that regard. So it's important. And also earlier we mentioned the case, I think, of the Medical and Dental Council, Disciplinary Council, as well as the one Okonkwo. This case explains the need for balance of interest. I'm trying to get a proper citation, but if you just look that up, Medical and Dental Disciplinary Tribunal versus Okonkwo, 2001, Nigeria Weekly Law Reports, part 7 Nigeria Weekly Law Reports, part 711. If you look at that, the Supreme Court attempted to create a balance where issues like this come up. That, oh, because I'm following code of ethics, I'm following a particular thing, then I may actually disregard the right to privacy. No, the Supreme Court believes that if that decision is not, if that decision to make a choice between what your ethics says or what another legislation says, that decision promotes something like, let's say, a public interest. That is when you can say that, oh, I'm following this public interest, I'm following this. But where that decision only affects the choice, only affects the consequence of that decision, affects the patient alone, then of course you have to agree with whatever the patient says in terms of privacy, in terms of his or her privacy, as the case may be. I think maybe some of us may be aware, may have seen, I can't remember I stumbled on it on TV at some point, maybe Bizarre Body or something on BBC Lifestyle, I think, where patients could expose themselves to camera, to be viewed by everybody, to be shared, to be viewed, and then their privacy is really exposed. That is the choice. The choice basically affects that patient at that time. But when you come to Nigeria, you balance it. That is where our own jurisdiction comes in. When you come within our own system, and the president said, no, I want you to take my picture or do this because this is what I want to use it for, and why you are maybe undergoing surgery. And then, of course, the public interest clearly forbids that in our own case. We following. So this is an angle of data processing that you may want to balance. It may look like a funny scenario, but as far as it goes, you have to be able to balance between what constitutes public interest in choosing what you want to do, in choosing whether you want to follow the law as it is, or you want to follow what your patients ask you to do.
Thank you very much, Dr. Latin. Thank you very, very much. That was very, very insightful. You keep mentioning Okonkwo. I just hope it's not me. I know Okonkwo are very troublesome people.
maybe it's your cousin.
Okay. So all this comes within the radar of health practitioners, and really it would be nice to hear from Dr. Ferdinand. Dr. Ferdinand is back. I think he had an emergency and he had to leave us. So Dr. Ferdinand, based on what Dr. Latunja has said, and so far, there are two questions I've been burning to ask you. And I'll just throw them at you at once. First, before the Patient Bill of Rights came in, and before the Nigerian Data Protection Regulation, what has been the experience for doctors? Like, how do you protect patients' rights? What has been the experience? Is there any ethics? I know there's a code of medical ethics, but how far has that been put in place? What is your experience as a doctor? And secondly, would you say that the whole rules, like the Patient's Bill of Rights, as well as the data privacy rights, would you say all this kind of hinders or what's the word now, incapacitate the doctor from really doing their work effectively? Not just healthcare providers, but also maybe HealthTech usage.
Okay, thank you very much. And I must apologize for coming in quite late into this seminar. like you have said, the Patient Bill of Rights is something that is it's a bill that is new, okay, and it's something that's welcome in the health sector. What I have noticed is that among doctors, among healthcare practitioners, that information, dissemination of that Bill of Rights is not very wide. Okay, I still see a lot of healthcare practitioners who are not aware that there is such a thing as a Patient Bill of Rights. Okay, so this is something that the persons who are responsible for proper dissemination of this Bill of Rights among healthcare personnel need to take up on. Okay, now back to your question. Doctors have always documented consent from patients before anything is done. Okay, now that is very largely understandable when we're talking of surgical procedures. Patients need to go to theater, but a lot happens outside of theaters that are usually not documented. So we usually just rely on verbal consent, which we take from patients. But the Patient Bill of Rights is changing everything, and the awareness that patients are beginning to get is changing everything. Okay, so right now, more people are documenting, more people are taking consent from patients, even before doing minor things. Okay, you need to take a consent. So that's quite happening right now in the health sector. And because of the high rate of litigation which is coming into the medical space, a lot of doctors are becoming more careful, and a lot of doctors are asking for consent to take documentation, pictorial documentation, video documentation, whatever you talk about when handling patients. Okay, so one way to bridge the gap, okay, is to ensure that the Patient Bill of Rights is well publicized so patients know their rights. I believe there are still a lot of patients who don't know their rights. Okay, now there's this big disparity when you work in urban centers, when you work in very high-end, enlightened societies and cities like Abuja. If I use Nigeria as an example, you have a lot of enlightened patients who know their rights, who have been to other climes, who have been to other parts of the world, and they know what obtains. But there's a big contrast when you look at patients who are in rural areas, okay? I'm sure the documentation which you see in the health sector is very, very low in rural areas. The message needs to go there. A lot of patients in the rural areas do not even have any idea about the fact that consent needs to be taken from them before you take a photo of maybe they've come in with a medical condition and you need to use that for a publication or a documentation, etc. You need to take a consent, and a lot of that is being done without patient consent. So I believe that that gap needs to be bridged, that bridge needs to come in where the information goes around to everybody and we close the gap as much as possible. Thank you, Ifeanyi.
Thank you very much, Dr. Bernard. That's really, really insightful. That opens the door for us to know what goes on at the back end from the medical space. So let me just throw my third question to you, and really that might be the last from me before we start taking questions from the audience. Please, all those at the gallery, please feel free to ask your questions. And of course, those of you who wish to speak during the question section, we are going to just raise your hand and we're going to allow you so that we can hear your voice. It's not a dummy section. All right. So, Dr. Ferdinand, how do doctors really feel about using health technology and telemedicine to deliver services? Forget what the law says now. And how do the doctors really feel? And also, who is that? Okay, so I was asking, I think that's Dr. Olatunji. You may want to mute, please.
Yes, you can come again. I didn't hear that. But okay. you know, let me repeat that this is Babatunde.
Okay.
Representing Dr. Olatunji. So let's
sure.
Let's get it straight.
So the question is to Ferdinand. The question is to Dr. Ferdinand. And I was going to ask, how do doctors really feel about using health technology and telemedicine to deliver services? Forget about the NDPR. Just tell us, how do doctors feel about that? And also, from your experience, how do patients feel about their data privacy using technology, like the taking of the pictures, using the app to speak with the doctors? What is the feedback you've gotten in your experience?
Well, I think COVID changed a lot of things. Okay, the coming of COVID changed a lot of things, and the need to embrace telemedicine became very more obvious because of the pandemic. And for a lot of hospitals here in Nigeria, for a lot of hospitals here in the FCT, telemedicine became a very good option to reach patients. So during the COVID pandemic, we had a lot of online consultations we had with patients, teleconsultations at home, follow-ups, consultations, but there's a big limitation. The limitation is you're not going to be able to examine the patients. Okay, so why the doctors have that as a limitation, not being able to examine the patient, not being able to do some very physical touch that you need to do to decipher what might the condition be, especially for surgical cases, surgical conditions per se. Okay, there are a lot of patients who still feel, I want to sit before my doctor to have a consultation. I don't think I get value for having a virtual consultation. Okay, so there's always still that disparity or unwillingness to embrace telemedicine. But by and large, it's something that is working. It's something that has come to stay. And it's somewhere, I think it's where the world is going to right now. So people are able to do a lot of virtual consultations, and people are able to come in after a consultation has been done, should the need arise for any further examination, any further investigations that will be more physical than virtual. So virtual consultation is something that's working. It's something that patients have come to accept. And we have patients who call us from Port Harcourt, from Lagos, and says, I can't fly in, let's get a virtual consultation. So right here in my facility, Seed Address, we do have virtual consultations available for patients, and I'm sure the same obtains for most other hospitals within the country and overseas. Now, teleconsultation is also something that the medical space uses. So among doctors, we are able to have seminars, we are able to have even surgeries. There are patients who have been operated on, where a doctor who is in an operating theater is talking to some doctor remotely, some other doctor remotely, and they're able to say, so this is actually still, you have a video coverage of it. Consent would have been taken from patient to say this is what is going to happen anyway. So apart from the fact that you're having consultations, even in the theater, telemedicine is also very helpful, okay, in terms of knowing what to do, deciphering what to do, and in very low resource setting, okay, in very low resource setting, telemedicine has come a long way to actually helping to reach out to those places, okay? So we have a situation where I'm sitting here in Abuja, and I'm consulting with patients in Boko, for example, okay, and through telemedicine consultation. I have just one doctor there, so I'm able to reach patients there who have gynecological issues, being a gynecologist, and we're able to talk, and we're able to solve solutions. So it's something that's really bridging the gap in this current global space that we found ourselves. In terms of going to your second question, where you talked about patients being able to accept documentation in terms of videoing and capturing. I don't know if I got that question. You might want to take it again, fine, please.
Yes, I was just going to ask about the feedback from you. Are patients embracing these HealthTech facilities and the telemedicine?
Yes, patients are, but I will still hang a lot. It's still not very widespread. And if you look at the comparison I gave before, when you have very good urban areas and you have rural areas, urban patients are more enlightened, okay? Urban patients are more educated, so they are able to use a lot of these internet gadgets, okay? And they're able to get a consultation easy, okay? But there's still that big disparity in terms of when you have rural dwellers who are not able to do all of that. But should you have a healthcare personnel, be it a doctor, a nurse, at the other end, even if you're talking to rural guys, okay, people who live in rural communities, you still will be able to make a headway, but there's a lot of challenges when it comes to that. Thank you very much.
Thank you very much, Dr. Ferdinand. That's very, very insightful. For want of time, I'm going to just rush through my last question with everyone. Victor, let me come to you. Currently, are HealthTech solutions designed to provide data subjects and patients with the right of access to their information? Just give us a real answer from your experience as a health tech provider. Would you say that these health tech solutions are designed in such a way that patients can actually assess their information? And if not, can this be achieved?
Okay, thank you so much, Ifeanyi. Presently, what exists today is there isn't really any access or much access for patients to have access to their medical information. The availability of data, I think, is a major issue in the healthcare sector. And I think this can be greatly improved on. Yes, it can be greatly improved on. It does not exist, but I think, yes, we can make it happen. Because if you take an analysis of the fintech or the finance industry now, there's a whole lot of control that exists there. And customers can have access, even transfer of information from one end to the other. But this does not exist in the healthcare sector. And I think through the help of the law, we can improve on this. Patients can have access, yes, under full compliance, where they have access to their information, their data, without the right to edit or to alter these informations that they have access to. Very, very important. Yes. Indeed. So I think it's something we can work on and we can greatly improve on. It's a gap. That gap does exist. I will consent to that, but we can greatly improve on it.
Thank you very much, Victor. And indeed, at the background, we've spoken a lot about new techs that are coming on board and how these things can be done, talking about designs and all that. But that's a story for another day. Let me come to Florence. I think Florence, yes. Florence, can you explain to our audience? Remember, before I said I was going to come back to you. I'm sure our audience are dying to know what practical steps they can take when a patient's right is breached or refused.
Thank you. If you recall, I had said earlier that there is a linear connection between a consumer or a patient who is sophisticated and the quality of service that they get. And so a sophisticated consumer is one who understands their rights and responsibility and can take advantage of the fact that they have a right to express their dissatisfaction. Obviously, because we cannot be in every health center, what we encourage consumers to do is to complain to the practitioner. We do assume and expect that medical facilities have some kind of complaint redress mechanism, as is anticipated by the PBOR. And so we expect that they put forward their dissatisfaction to the facility, and hopefully they get the outcome that they desire. However, if for some reason the outcome is unsatisfactory, they're allowed to escalate that complaint to a sector-specific regulator, in which case would be the Medical and Dental Council or any other regulator. But if they are still dissatisfied, they're welcome to come to the FCCPC.
Thank you very much, Florence, for that wonderful contribution. I think Leo Odudu has made an important contribution relating to the question that I asked Dr. Ferdinand earlier. It's noted that in practice in mainland Lagos, our experience is that the majority of patients prefer physical consultation with the doctor. The human contact and touch is still invaluable in practice, not downplaying the effect tech has on improving communication between doctors and all that. Indeed. So that might give some insight really as to how patients take these things. Can I ask Ifeoluwa, my last question to you, Ifeoluwa, do you think the principles of data privacy and patients' rights frustrate or support the data partnership between hospitals and health tech companies?
I think that the principles of data privacy and patients' rights are necessary to protect everyone, right? To protect the patients, to ensure that there's responsible use of data, and to ensure that kind of like, you know, the benefits of data, there are no nefarious entities using the data wrongly. So I don't think they frustrate. I think they can appear to frustrate when you are maybe trying to move quickly and you're not being thoughtful. But I think it's important, like healthcare data is so critical, is so sensitive that we have to be, you know, we have to put data privacy and patients' rights at the forefront of what we do at healthcare. So I don't think it frustrates. I think there's an opportunity, it opens up really an opportunity for deeper collaboration. So there are different entities around the world now that are thinking about, you know, responsible use of healthcare data. There's this coalition called the Health Data Governance Principles, right? And um, that acknowledges the importance of patients' rights and also acknowledges the importance of sharing healthcare data responsibly. Because, for example, one of the things in the Patient's Bill of Rights is access to your own healthcare data, right? And one of the things that can make healthcare data access, give patients easy access to their healthcare data is digitization. You know, we foresee at Helium Health, we want a future where no matter where you go, your healthcare record follows you, and you have kind of like a longitudinal record of your healthcare, so that you know you're able to transfer as you wish. You're able to, you know, be in the driver's seat of your own healthcare. And it is principles, it's healthcare, it is, you know, building upon the patient's rights and being mindful and compliant with data privacy that we can kind of like reach all of this exciting promised land with health innovation. So I don't think it frustrates. I think it might appear, but it doesn't.
Thank you very much, Ifeoluwa. Thank you very much. And in the same breath, let me ask Ngozi, in your opinion, would you say there are contradictions between the provisions of the NDPR and PBOR, that's the Patient Bill of Rights, in relation to data subjects' rights? Or would you say they complement each other?
So my very straightforward answer to that would be they complement each other. Confidentiality of patients' information, right to information, is a subset of what the data protection framework already, you know, provides. So clearly, what the Patients' Bill of Rights does is to provide context, sectoral context, for some of the principles that the NDPR already, you know, lays out. So I think you can't go wrong by complying with the Code of Medical Ethics and Patients' Bill of Rights.
Yes, and finally, let me wrap up with the last question for Dr. Vincent Olatunji. We know that there's a time frame within which all data controllers, including HealthTech and healthcare providers, are required to comply. So we know that the deadline of June 30, 2022, at least for this year, is almost coming to an end. Is that time going to be shifted, or are there, or is it just a stamp date? Are there any risk or penalties that are awaiting non-compliant companies, especially in the healthcare space?
Thank you. As of today, that is the deadline that we have. If it will be shifted, that will be communicated. But as of now, we don't have any information to give in that area.
Okay, thank you very much. And thank you everyone for listening carefully, ladies and gentlemen. That brings us to the last part of this session, questions and answers. Please, if you have any question you'd like to ask, please feel free to raise your hand and we will get to you. I note that Ujunwa DK has, okay, she's agreeing with what Leo Dudu said previously on the concept of touch and physical consultation over HealthTech consultation. Yes, okay, I see Damola Adediji. The hand is open. if we can unmute Damola Adediji. Let's quickly hear his question and then take it. Also from the Q&A, we can see some questions there. Is Damola okay? Is Damola here for us already?
Yes, I'm here. Hi.
Okay, please go ahead with your question.
Okay, so I had asked a question regarding the use of data, especially since we have someone from the FCCPC. Okay, so my name is Damola Adediji. I'm a doctoral student in computational law and copyright at the University of Ottawa in Canada. I'm joining in from Ottawa. So my question is directed to the FCCPC representative here. So throughout the world, we have seen that data is becoming, and it was a delight to listen to Mrs. Adebigbe.
Florence, yes.
Yeah, so.
I think we've lost.
Hello?
Sorry, Damola, for a minute we lost you there. But I heard that your question is directed to Florence.
Yes, hello, can you hear me?
Yes, we can hear you, Damola.
Okay, so I would like to know if the FCCPC is looking at enforcing antitrust provisions in the digital markets broadly. How is FCCPC preparing? Because I know that in Canada, in the EU, in the United States, there are antitrust and competition rules. There are law review efforts going on to make sure that the reality of the digital market, not just HealthTech alone, not just e-commerce alone. So people are using data, for example, to reinforce economic dominance at the expense of the consumers. So I would like to know what and how is the FCCPC preparing? Yes, we know it would be unfair to expect the FCCPC to gain the stature of not even the DOJ in the US or the European Commission in the EU. These institutions, they have existed for a long time. Not even South Africa. You know, we know the FCCPC is just came into being in 2019. So I would like to know what effort the FCCPC is making to make sure that they are ready for disruption in terms of antitrust in the Nigerian digital space, and not just healthcare, because this affects every industry, from music to pharmaceuticals. There are so many digital gatekeepers now, you know. So I would like Miss Abebe to emphasize on that. Thank you.
Thank you very much, Mr. Adediji. I did attempt to answer the question in the chat, but let me say that as you might be aware, the FCCPC, pursuant to Section 17, is allowed to interpret or administer and enforce any provision of law that borders on competition or consumer protection. And one thing that we say is a consumer welfare is the ultimate interest or objective of competition. And so competition is just a tool. Competition policy, is just a tool that's used to ensure that we ultimately can protect our markets and our participants in those markets, which include the consumers. And so what we say is consumers should not be better protected in our traditional markets than in our digital markets. And so you raise a very valid point with respect to data. And so what we, and potential abuse of dominance. And so what we do is to make a clear distinction between, data privacy, which is a consumer protection issue, or the commercialization of that data, which could then lead to this anti-competitive concerns that you're raising. But there are a lot of issues to take into consideration. And we do know that even in the advanced jurisdictions, they still struggle with this, specifically because we have to, one, demarcate the market. How do you delineate the markets that is digital, especially when there are zero-priced markets? Consumers are receiving these benefits for paying nothing. And so the real issues of data privacy, data consent, we have to deal with. And these are conversations that we're participating in around the world, whether it's with the EU or with the FTC and DOJ in America. We are actively considering these things. And what we are saying is the NDPR provides a key legislation for us to piggyback on. The FCCPA provides legislations for us to piggyback on. And so the combination of the power to enforce and these ex-ante regulations allow us to look into potential commercialization of consumers' data and carry out inquiries and investigations. And so the Commission is looking at how to domicile this by delineating the market, considering whether the conduct of the data controllers are exploitative or exclusionary. And based on that, we're definitely looking into potential inquiries and investigations in that sector. And we have actually started. You may not know, but the Commission has been looking into the very recent privacy policy updates by WhatsApp and Facebook. And we're also looking into loan sharks investigations. As you may be aware, we've carried out a few done raids. And the real issue is, how are you collecting this data? How are you storing this data? How are you democratizing this data? And what are the third-party rights? So when you send messages to other people who are not part of the contractual relationship, you are able to access it because you have waived consumers' implied rights as data subjects to their own data, and which is a fundamental issue we've discussed here today. And so, yes, the Commission is actively participating in those conversations, and we recognize the difficulty in delineating the markets, but we are saying that we can interpret our laws flexibly and in an open way that allows our digital consumers to be just as safe as our traditional consumers.
Thank you very much, Florence. Thank you very much.
I'm very grateful for your robust response. I would just add this bit. I know that in the digital market and competition regulators are delineating the markets, not just based on price mechanism, because data now people are, rather than monetary way, people are now buying services through the supply of, or just by supplying their data, and these data are now being exploited for commercial gain. I would really like if the FCCPC expands their view regarding market definition, especially in the digital sphere. Thank you.
Thank you very much, Damola. Thank you very much, Florence. Apologies. For the sake of time and giving others an opportunity to take a bite, we may not be able to push harder on that. I see a question also is on the chat box. We want to try as much as possible to take as much as we can. So I see one by Kelechi Mukede Habat. Says, Mrs. Ngozi, how do health maintenance organizations fall within the radar of the NDPR and PIBO in their partnership with hospitals and healthcare facilities? I think this has been answered before. but please go ahead.
All right, so I would start out by saying that health maintenance organizations, just because they are data controllers, fall within the ambit of the Nigerian Data Protection Regulation, because that regulation applies to all data controllers, and essentially any employer of labor is a data controller. So that's a general statement I will start out with. Now, with respect to the specific context, which is the relationship between health maintenance organizations and the facilities that they provide patients for, I would say the nature of HMOs, the nature of the business they do, requires them to share data, because basically you get your clients from the employer organizations, and then you hook up the employees who are considered to be patients or potential patients. You hook them up to the hospital. So you really play a middleman's role. That requires you to share data. It's almost inevitable. I know I've had conversations with HMOs who also argue that they don't necessarily pass up information to the healthcare providers. They only provide information when the patient approaches the healthcare provider. For instance, if I have subscribed to a particular HM1, a particular hospital, until I need that service and I approach the hospital, that's where the HMO then passes my information to them. I think that's really like, those are metrics that HMOs deal with administratively internally. At the end of the day, you're really going to have to share information. And so it's important that HMOs have the data protection agreement with all the healthcare facilities that they work with. And of course, they need to have a similar agreement with the clients, the employer organizations from which they get the pool of patients they refer to these hospitals. I hope that answers the question.
All right, thank you very much, Ngozi. For want of time, we'll just take two last questions, one from the Q&A and the last from Loki Okbara. I don't think I can pronounce that. From the chat, we have, is the deadline for the audit or for full compliance with the NDPR? I think Dr. Latunji, if he's still here, as represented by Babatunde, can you please answer that question for us? He's asking if the deadline of 30 June 2022 is for the audit, that's for companies to have filed their audit, or is it for full compliance with the NDPR? Oh, sorry, Ngozi, do you want to take a bite at that question? I think we lost Dr. Latunji there.
Okay, that's fine. So the deadline is for submission of the audit report. Now, let me take a step backward and give some background. What the regulation requires every data controller to do is to conduct an audit of their processes to see how it compares or how it complies with the regulation. Now, truth be told, this regulation is just about 3 years, and we've only been ramping up, awareness. And so it is not unlikely that a company that does the initial audit will find that there are lapses. And what the regulators have told us previously is that the approach is to see that there are improvements year on year. So even if you are not fully compliant, the important thing is that you take steps to cover the gaps as soon as possible, so that the next audit you're showing improvements in your compliance metrics. But I would generally suggest that when it comes to audit, because you're filing this with the regulator, the big bullet issues, right, like having a proper privacy policy, these are things that I strongly advise, as a consultant on this, I strongly advise that companies close those gaps before they file even their first audit, for two reasons. Number one, the risk of non-compliance is high, it's apparent, right? You really want to, give people an opportunity to know what your privacy policy is. And so it's important. Number two, it's not as difficult. It's not time, it doesn't require you to revamp your entire process. It only requires you to carefully think about all the ways you use data and communicate it effectively. So there are big, items like that that I would generally say you should have in place before you file even your first audit report.
Thank you very much, Ngozi, for that holistic answer. And for the last question, and then we'll close up this webinar. Lucky, you can now ask your question.
Yeah, thank you. Good afternoon, everybody. Yeah, please, can you let us know the body that is the direct agency that is in charge of healthcare and how we can get these requirements? Because when the law came out, we tried to contact MITDA, who said there's a bureau coming up soon, and those people will be directly involved, that they are in charge of information technology, and for hospitals and co, we will get to know. So until this now, we didn't know how much information has come out over the years. So can you assist us? How do we get their contacts, the website, who do we meet for this audit and compliance? Thank you.
Okay, Lucky, thank you. There are several organizations in the healthcare space. I think what we'll do after now, please send your email to me, and then we'll just send you a guide. There's a guide infographics that you can use. There are several of them. All right. I think that's all, and we are 2 minutes past the time. Thank you, everyone. I will pass this back to Ms. Chinyere. If Chinyere is still here, I'll pass back to her, and then she will do the closing remarks. Thank you very much, everyone.
Wow. Did we have an interactive and interesting and even informative discuss on these issues? I totally think we did. And if you think we did, you can let us know in the chat box. I think all the speakers brought their A game, professionals and experts in their own right. Suffice it to say, as a roundup, that it's very important that as healthcare providers, practitioners, stakeholders, indeed, any aspect of the healthcare service industry that you might fall under, it's very important that you take cognizance, or maybe should I say avert your mind to these two critical regulations that we are spotlighting today. It's very important that you comply, because the penalties for non-compliance are very steep. What we find as medical legal practitioners is that people tend to shun the rules, or they cast a deaf ear to it, and they only come to us when maybe they've been hit with a fine, or perhaps they find themselves in a litigious action and now need to defend themselves. So I want to thank all our panelists today who have spoken so knowledgeably. Thank you so much for your time. Thank you for being here today. Thank you to all the attendees, our clients, all members of the public who joined here today. Thank you so much for joining. I believe we are going to make the recording available. Correct me if I'm wrong, Ifeanyi, but I think so. But one thing I can promise you is that anytime we do a webinar like this, we usually collate the thoughts of the industry leaders or thought leaders in this space as discussed here today, and we compile them into a sort of communique, which we now share out, and hopefully if there are recommendations, these are also shared to the regulatory authorities, the government bodies who are responsible, and indeed we continue the stakeholder engagement that ultimately results in change. So once again, thank you to everybody for joining. I also want to thank you, Ifeanyi, for your expert moderation of this panel today, navigating the different nuances. Thank you so much for that. And it's a wrap. Thank you, everybody.
All right. Bye, everyone. And for those of us who are taking a long journey.
Thank you, everybody, for joining in. Thank you.